This table basically discuss about three groups of drugs: antiprotozoal, antifungal, and antiviral, right? The first one is antiprotozoal, we said. Antiprotozoal are the drugs we use to treatment of protozoal infection. Protozoal infection, I said. So there are so many protozoa like Entamoeba histolytica or Neisseria, right? But here we are going to focus basically one of the most important medication what we use. It is basically metronidazole, right? Metronidazole. The metronidazole is most popular name is Fragile. We use it. The indication of antiprotozoal, they are very effective again the anaerobic bacteria or any kind of protozoal infection, right? So protozoa actually one kind of parasite, right? Or we can say anti-parasitic medication or parasitic disease. Some of the parasites like helminthes, when attacked, we use this anti-parasitic. So anti-protozoal infection, I said, the most common, they causes the diarrhea, very bad diarrhea. So very bad diarrhea they cause, and also they causes sometimes bloody diarrhea. So metronidazole used to treat the infection of any infection in the GI, gastrointestinal system, basically. And I said when you prescribe the metronidazole, we can educate the patient about the side effect of these groups of drugs. So metronidazole sometimes used with other antibiotics or some antiprotozoal. So side effect, they causes GI upset like nausea, vomiting, and diarrhea. If patient has any kind of reaction to metronidazole, allergic reaction to metro, even occasionally patient started the seizure, definitely in that case we could move the medication, switch the medication. What are the other common side effect of metro? They causes dark urine or metallic taste. Very important, and clicks would ask the question. And also they cause dizziness or diarrhea. So you could educate your patient after using this medication. It is good not to driving, not to do any heavy machinery work. So now let's go and give a focus the second group of drug. It is called antifungal, right? Antifungal. So antifungal medication most commonly we use for, just for fungi infection. So antifungal medication, also known as antimycotic medication, they has a property of fungicide or fungistatic, means some of them kill the fungi and some of them inhibit the growth of fungi. So used to treat and prevent mycosis, such as athletic foot, we use this medication, or ringworm infection or candida infection, which is called oral thrush. Sometimes antifungal we use for systemic infection. It is called systemic antifungi. So serious systemic infections such as cryptococcal meningitis. In that kind of scenario, doctor prescribe systemic antifungi. Very few antifungi you can buy over the counter, right? So most commonly antifungi we use called amphotericin B and ketoconazole, right? The side effect, what we should know about antifungi here, they're highly toxic to your liver, highly toxic your kidney, right? So if you prescribe these two medication, we always monitoring liver function and kidney function, right? So because they are hepatotoxic, another thing, if you prescribe your patient, or if you know your patient taking this medication, tell your patient, if you see your dark color urine or jaundice or anorexia, malaise, fatigue, nausea, always come and inform healthcare provider. So jaundice, anorexia, malaise, fatigue, nausea indicate the kidney not working well. The liver does not working well and need to check the liver function, or liver function testing should be completed prior to this medication, or every monthly if patient continue this medication. Or it is also important, you could advise the client report to the doctor office if they see any manifestation of hepatotoxicity. And this antifungal and alcohol better not to take together. Antifungal, especially amphotericin B, can cause nephrotoxicity as well. So we could check the renal function test like serum creatinine and BUN level. The antiprotozoal amphotericin B or systemic antiprotozoal can cause bone marrow suppression. So if the patient have bone marrow suppression, because bone marrow can produce white blood cell, red blood cell, and platelet. If bone marrow suppressed, patient develop leukopenia, thrombocytopenia, right? Or WBC reduced, patient develop anemia. So if patient develop anemia, they easily get tired. If you not treated, patient develop heart problem. If patient took this medication, we could monitoring any kind of bleeding tendency, ecchymosis, red spot, or gum bleeding. Also, infection is most common because WBC go down, leukopenia, because of bone marrow suppression, right? So if you prescribe this medication, what are the most important to monitoring liver function test and monitoring the kidney function test, right? So pale stool, dark urine, nausea, vomiting, fatigue, jaundice indicate there are liver problem. So we educate my patient if you have any, notify healthcare provider. And the other medication here, it is called antiviral, right? Antiviral medication, they treat any kind of viral infection, right? Most antiviral target to specific viruses, while the broad spectrum antiviral is effective against a wide range of viruses. Antiviral drugs are one class of antimicrobials as well, right? Most antiviral are considered relatively harmless to the host, therefore can be used to treat the infection, right? So it is very important, keep in mind, the antiviral does not kill the virus, but they can stop the growth of virus. They can stop the replication of virus. Antiviral drugs most commonly we use acyclovir or ganciclovir. Acyclovir basically work against the symptom of herpes or varicella zoster. Ganciclovir more effective against the cytomegalovirus CMV. Another antiviral is called AZT or or it is called zidubudin. Zidubudin is good against HIV patient. But like zidubudin, take once an empty stomach. And after giving this antiviral medication, it is good to check complete blood count because sometimes patient develop anemia. So what are the other side effects of antiviral medication? Like here, antiviral, especially acyclovir or ganciclovir, they cause phlebitis or GI upset. GI upset, I said, nausea, vomiting, diarrhea. As like as fungi, they also causes hepatotoxicity and nephrotoxicity. Especially ganciclovir can cause nephrotoxicity. Acyclovir or ganciclovir both can cause bone marrow suppression. If anybody have a bone marrow suppression, they easily develop anemia because lack of RBC. They easily develop leukopenia because lack of white blood cell or neutropenia. So neutrophil is one of the member of white blood cell, and neutrophil fight against infection. If you have a less neutrophil, infection easily catch up. And also patient develop thrombocytopenia, means platelet count is go down, right? So antiviral, antiparasitic, antiprotozoal, and antifungal are important for our NCLEX board.